Okay. Well, first of all, good afternoon, everyone, and welcome to today's webinar on using public health core competencies for hiring purposes. And my name is Guadalupe Pacheco, and I serve as a program director for the National Hispanic Health Foundation. And let me first start by acknowledging that this webinar is sponsored by NHHF and the Association of Schools and Programs of Public Health. We are grateful for their partnership in making today's session possible. This webinar is part of NHHF's larger efforts to address one of the most pressing challenges facing the public health sector: how to recruit and retain a strong, skilled workforce. Across the country, public health agencies are working to fill critical positions and keep talented professionals engaged. And I say engaged. That's why today's discussion is so timely. Over the next hour, the focus will be how to use public health core competencies, the essential skills and knowledge expected of public health professionals, and can be intentionally integrated into job descriptions. This approach will help employers make their hiring processes more effective, their teams better equipped, and their organizations more positioned for long-term success. And this session is designed for public health employers, HR professionals, and workforce leaders. And it will provide you with practical tools, real world examples, and national insights that can help, that you can apply to your respective organizations. With that, I am pleased to turn over the program to Dr. Rios, the president of NHHF, who will introduce our featured speaker, Dr. Heather Krasna. Elena?
Thank you, Guadalupe. Let me just, sorry. Okay. So today, as Guadalupe mentioned, we're very honored to have Dr. Heather Krasna talk to us and teach us some of her lifelong research in the area of public health. I'm going to say public health careers. She serves as Associate Dean of Career and Professional Development at Columbia University's Mailman School of Public Health, and has over 25 years of experience helping thousands of mission-driven professionals build careers in public health. Dr. Krasna is the co-author of 101 Plus Careers in Public Health and the author of Jobs That Matter, two widely used guides for anyone interested in making a difference through public service. Her research on employment outcomes and job postings for public health graduates is the largest of its kind and continues to shape how we think about workforce development. Today, Dr. Krasna will be discussing with us the importance of incorporating public health core competency into job descriptions and how doing so can enhance hiring practices to strengthen our workforce, especially at public health agencies that are government agencies at a local, state, and federal level. This discussion connects directly to our National Hispanic Health Foundation's Public Health Workforce Program that is now called A Stronger Workforce, Healthier Communities, supported by CDC and with an outstanding advisory committee and staff led by Guadalupe Pacheco. And honestly, this program, our workforce program, and Dr. Krasna's experience is all about increasing awareness for persons interested in applying to public service, but also for the hiring officials who have to build our public health workforce to focus on building our community's efforts to be healthy and be a functional part of our economy. And with that, I'll turn it over to Dr. Krasna thank you again for honoring us with your experience and expertise today. Thank you.
Thank you so much, Dr. Rios. It's such a pleasure to be here today, and it's really an honor to be speaking to this group. I'm going to just dive in to the presentation. We have a bit of a small group today, and so if anyone has questions, comments, feel free to just write them in the chat, and I will keep an eye on that as I also do the presentation. Also just a note, if everyone could just mute, or if I can ask the host to mute everybody who's not speaking, that would really be helpful to minimize any echo and things like that. So thanks for that. So today, as we discussed, I'll be talking about how do we use public health core competencies to strengthen the public health workforce, especially through hiring, through recruitment and retention, and even workforce planning. So hopefully you'll get your questions answered about how do we use these competencies and how can they be helpful. So today I'm going to be talking about what even are these core competencies? What are competencies in the first place? What are the core competencies for public health? And who uses them? I'm also going to talk a little bit about other core competency models. There's actually a whole range of different competency models for different occupations and professions. And I'll talk about why competencies matter and can be helpful in workforce development, recruitment, retention, and so on. And then we'll talk about how do we use those competencies when writing job descriptions. And I know that the topic of job descriptions is not something everyone thinks about all the time. We sort of take job descriptions for granted a lot. And I'll also be honest that reading job descriptions is not like, reading great works of literature. Sometimes they're not that exciting, but they're really important because, and I'll talk about why, but there's many reasons why having a clear job description can be really, really helpful for recruitment, for workforce planning, for training, and retention. And then how do we then connect the dots between the core competencies and job descriptions? Then I'm going to give some tools and some examples of other organizations that have actually included the competencies in job descriptions, and a bunch of different resources and trainings that have been developed on this topic. And then I'll give a little bit of a discussion about maybe future trends, workforce strategies, and things like that. I am always careful talking about the future of public health because it's pretty unpredictable, but we'll try to cover a little bit of that. So what are these competencies anyway? What do we even mean by competencies? I am guessing that if you work in anything related to workforce development or HR, you've probably heard of competencies. Many other people maybe have heard of them in general, but maybe haven't used this idea of competency. So what I think of as a competency is kind of an umbrella under which you've got a bunch of specific things. It's basically the knowledge, the information that you have about a certain subject, the skills, which is particular tasks that you are able to do. You've learned how to do these particular tasks. You have a skill in a particular area of able to use those, that knowledge or ability to take action. Ability is more innate. It's more about that you have the capacity or potential to use a skill or to develop a skill. And then a behavior is what we can see from the outside about what an individual is actually doing. So when you put them all together, then you can come up with a competency. So the competency is like it captures all of these different ingredients. And it's basically explaining what exactly is it that we would expect someone to do in order to be good at their job, whatever that job is. And, every person, every job may have a little bit of a different profile of which competencies are really needed. But there's some that are across the board important in certain fields. And that's why public health has a set of core competencies. So it's basically taking these sort of more specific, granular ideas about skills and knowledge and ability and so on, and compiling them into these the behaviors that we need to see for someone to be able to do their job well. So there's a few different definitions here. And what about core competencies for public health professionals? So there's a few different competency models. The consensus model that's used in public health was developed by the Council on Linkages, which is connected to the Public Health Foundation. It's 23 different members, organizations that came together and developed these competencies. The core competencies have been around for many years, and they are kind of broad. There's broad-based kind of domains, which I list here on the slide, of data analytics, policy development, program planning, communication, health equity, community partnership, public health sciences, management and finance, and leadership and systems thinking. And again, it's almost like those are the umbrellas, and within each one, you have these very specific competency statements. And you can see all of this if you visit the Public Health Foundation website, phf.org, and you can download the competencies. They do get updated. I remember the past experience of when they were last updated in 2021. The wording may change. There might be new skills or knowledge areas that become important. And so you can see that they do change over time to stay updated with the needs of the field of public health. So just as one example, if we look at that big domain, the first domain of data analysis and analytics and assessment skills, you'll see that there's all these sub lists, which are things that we want someone to be able to do if they are competent in data analytics and assessment. And what's nice about this is that this is pretty tangible. We could measure this. We could say, hey, do you know how to collect data? What would that look like, collecting quantitative and qualitative data? Maybe that means you have at least some knowledge about what a survey should look like, or maybe how to run an interview or a focus group. You don't have to be an expert, but you hopefully have that a competency that you know how to collect data, or you know how data should get collected. You know at least something about how data gets analyzed, maybe how to manage data, and then how do we actually use all that data when doing our job in public health? What's the big picture here? Every public health professional has to at least have some knowledge about data analytics, data assessment, because we are a data-driven field, right? Epidemiology is one of the core knowledge areas of public health. That doesn't mean that every single person in a health department or a public health organization has to be, a biostatistician who can do all the fanciest linear regression and all the things like that. But it just means we should have some knowledge about analytics. And thank you for sharing. I see somebody put the competencies in the chat, so definitely go visit and explore that. So thank you for sharing that. There's also another element about the core competencies for public health professionals, which is that there are 3 tiers or levels. So this is also handy because you'll see in a lot of public health organizations, the classic that I always think of is at New York City Department of Health and Mental Hygiene in New York, where I'm located. They have a city research scientist level 1, level 2, and level 3. And you'll see this all over the place: epidemiologist level 1, level 2, level 3, etc. Not every career has levels like that, but you'll see that a lot in different job descriptions. And what's handy about these competencies is they also have levels. So they have that frontline level that maybe when somebody is first getting started in public health, or they have a position where they are directly serving the public, or they're doing direct service in some way, or they are, they call it the frontline worker. They just started out potentially, or they have that very on the ground, hands-on job in public health. That's the first level. Then you have the person who may be managing a program. They might be supervising some people. Maybe they are planning and evaluating a program and overseeing a budget, that mid-career kind of level. Then you have the senior level manager, the leadership level, and so forth. And so just as an example, you have, and this is, you'll see that some of these competencies, and then it goes into the details of these sub-competencies. So just again, picking that example about the quantitative data, if we're talking about managing data, if you're at the front line, then you would be contributing to the development of maybe a data management plan. When you're in that second level, you'll actually be developing, not just contributing to, but developing. And then if you are on the senior level, you would be ensuring others and sort of spearheading an initiative. And you'll see how these are each different based on the tiers. And so, if you're that senior level tier 3, then you're overseeing or supervising or leading a team and making sure that the project gets done, even if you're not the one actually, doing this specific task every moment. And someone asked in the chat about how do we connect different competencies together? And guess what? I'm going to talk about that in a second. So someone had a question about how do these different competencies connect to things that are for specific occupations or professions. So guess what? In 2 seconds, I'll be talking about that. So you'll see that, this is cross-cutting. And like I was saying, maybe not every single person in every public health job needs to have, level 1 of all of these different subcompetencies, because different jobs in public health will be different. But this is just a nice guidance to kind of give an overview of what everyone should hopefully have some knowledge about in public health. So how do we use all these core competencies? They're used in a bunch of different areas. So Public Health Accreditation Board uses them in the workforce development piece of the accreditation. They are connected with the Council on Education and Public Health Competencies, which is what schools and programs of public health that are accredited by CEF will use. You can pretty much connect the dots between the CEF competencies and the core competencies and so forth. They're used in the Train Learning Network, and a lot of health departments do incorporate them in one way or another, some way. They're also part of the Healthy People 2030. Now, they also connect, I'm doing a lot of connecting dots right here. So they also do connect and they match up with other frameworks that we use to talk about public health systems and services. Because when you think about it, and this is why this makes lots of sense, that in order for a public health system to do what it needs to do, such as these 10 essential public health services, which many of you have probably seen, this is used by the CDC and lots of other places. This is basically what do we need the field of public health to actually do to maintain and protect and promote the health of all people in all communities. These are the 10 essential services. Well, in order to make those services actually happen, you need to have some human beings who have the abilities, the competencies to make those things happen. So we can actually connect the dots there. There's also the other frameworks, which are also used, the public health systems framework of foundational public health services, which is more kind of, I think, a little more specific to public health departments. And it's basically saying, what should your health department actually deliver? What should it actually be able to do? And so again, they do connect. And just as an example, this is one way you can kind of match them. This is just an example, but we're sort of connecting between the 10 essential services, the foundational public health capabilities, and then those public health core competencies. So it makes sense, one of the 10 essential services is let's monitor the health status. Same idea with the foundational public health capabilities, where we have to have assessment and surveillance. But in order to make that happen, you need some people that have competencies in the analytical and assessment skills and data analysis. Same thing with communications, community partnerships, assuring a competent workforce. These things all do make sense together harmoniously. So now I was going to mention that, and this has come up in the chat also, that there's other competency models. I mentioned CEF, the Council on Education and Public Health. There's actually a couple of other, they're not exactly all competency models. There's different frameworks. So de Beaumont Foundation also has a list of strategic skills. And then there's even things like if you are taking the Certified in Public Health exam, which is put together by the National Board of Public Health Examiners, there's a list of knowledge areas that you get tested on, and they all kind of connect to these core competencies. Now, there are crosswalks between these different models. And in the slides, which I'm going to share after the presentation, there are all the links to, in the notes for the slides, there's hyperlinks to the different articles and websites where people have kind of done this connecting of the dots between the core competencies and the CEF competencies and the competencies for the de Beaumont strategic skills. So they do all connect, and you have to do a little digging around on the internet to find all the places where people have connected all the dots, but I have those and they are in the slides. So if anyone has questions afterwards, I'm always glad to share that also. And then I wanted to talk about other competency models, and there's kind of a lot of them actually. And on this slide here, you'll see two different sources where people have tried to gather up all of the possible competencies that we might find in specific public health jobs. And just as an example, right, like some of these are very specific, and someone had mentioned in the chat about certified health education specialists, for instance. So, and I never know how to say this, NCHEC, right? They are the folks in charge of the CHES and the MCHES certification. They have a job analysis. They have, you know, knowledge that you need to have in order to be certified as a certified health education specialist. That's an example of something which is pretty much a competency model. Same thing with epidemiology. You have the CSTE, Council of State and Territorial Epidemiologists. They have a list of the applied epidemiology competencies. So there's an article that I published, which is like the references on the slide, where I spent a whole lot of time reading job descriptions, and it was not as boring as it sounds. It was actually kind of intriguing. And I looked for all of the different competency models that could be found in public health. There's even one that I didn't include in that article, which is for public health law. There's a set of competencies for public health law. There's a set of competencies for legal epidemiology. It goes on and on. There's actually a lot of really interesting ones. And then the Public Health Foundation also has a list of discipline-specific competencies. There's some overlap, of course, between the article that I had written and what Public Health Foundation has. So if you want to dive in and you want to really go into what are some of the competencies, you have public health nurse competencies, you have SAMHSA for mental health, they have core competencies. There's public health informatics, they have core competencies. It goes on. So definitely there are some specific competencies for very particular occupations in public health. And I see a few questions, so I'm going to just pause and see if folks have questions. You could just write those in the chat if you like. How can public health core competencies be further promoted among public health departments? So that's an excellent question. I basically, I'm going to get into how we could incorporate them in job descriptions. Could I ask everyone to mute? Thank you so much. If you want to if you want to ask a question, you could also just raise your hand, and I should be able to see that in the chat, because but definitely they can be incorporated into job descriptions. And I think a lot of the health departments have put in a ton of effort because of the public health infrastructure grant. Some of the recent investments, many of them do have a workforce development person on staff. And so that would be the perfect person to look at the competencies and see how they could be incorporated. So does anyone have other questions before we go on and start diving into job descriptions? I hope I covered some of the questions that came in about how do we connect the dots with things like National Commission for Health Education Credentialing. That was the organization for health educators. Any other questions before we go on? Okay, awesome. So let's talk about job descriptions. Again, it may seem like not the world's most exciting of topics, but it's, again, really, really important and should not be taken for granted. Why do we care about job descriptions? There's a lot that they do, that the function of the job description. I mean, it's definitely used in recruitment. And if you have the right description, hopefully it kind of attracts the right candidates who have the right skills and competencies for the job. It also is required usually for HR reasons. There's civil service departments that often have a lot of say over the job description. It's important for equity and fairness that we have, standard descriptions that we, make sure that everyone adheres to. And it's important that the way they're written encourages people of all different backgrounds to apply for positions. That's really important. There's actually a whole science of making sure that the way a job description or a job posting, like a job advertisement, the way that it's written so that it doesn't discourage particular groups of people from applying. So that's something to think about. And it's also great to be used for managing expectations and performance on the job. So it's great to refer back to job descriptions as you are looking to, for example, if you're working in a certain role and you feel like you're not doing a particular task that's in your job description, that's something you could refer to. You could refer to that to ask for training. When people are looking to get promoted, it's also really great to have the job descriptions available to know like what's that next step. And in terms of what are the ingredients, this is just a common set of things that are included in job descriptions. Of course, you got the title. One thing I'll mention is sometimes if you work in a government agency, you'll have these generic titles. So like I was mentioning in New York, we have the city research scientist level 1, 2, and 3. That doesn't really tell you too much about what the person's actually doing. So there's kind of like the working title, which is more specific to the actual job. It might have the name of the program in it. And that's important. There's usually a quick summary of the job and then a list of the details and duties and responsibilities. That's usually a set of bullet points. And then this is really important, the required versus preferred. Required qualifications, those are things that are essential. So, and people have to think about them. And this is something that I encourage people to think about, especially when you're looking to ensure that the workforce reflects the community that you serve. So for example, lots of times there's a way to substitute education with experience. And I also ask people to think about, is it truly essential or is it just preferred for the person to have a specific amount of experience or a specific degree or credential? Of course, there's certain positions like public health nurse. Person's probably got to be a registered nurse. They have to be, certified or credentialed to do that work. But, thinking really hard about what's truly essential for the person to be able to do the work and what's bonus points, extra would be great to have, but not essential. And there's all kinds of research that shows that, unfortunately, some populations will say, oh, I'm not going to apply to this job because I don't match 100% of their qualifications. Where other populations may look at it and say, oh, I meet at least 50% of these qualifications, so I'll definitely apply. So when I do career coaching with job seekers, I always tell people, when in doubt, go ahead and apply for that job because at least you increase your chance by applying. So, but writing the description in a way that invites a diverse group of candidates is really important. Then there's information about the working conditions, and this is the stuff you'll see talking about often the physical demands of the job. This is important, and it gets into some legal issues around the Americans with Disabilities Act and other rules, laws. I am not a lawyer, so I never get too detailed about this, but I always say this is why it's super important to make sure that your job description is reviewed by HR or the Civil Service Department to make sure that it's accurate and correct. And also that you think about it and ask, is it really truly essential to have specific physical demands in a particular job, so can it be, this is basically getting to, can the job be done with or without, reasonable accommodations? So that's a really important thing. Compensation and benefits, this is also important. And this is not about the competencies. This is a little side suggestion. But one thing that is really important to remember is that if you're, many times a public health organization, they may not be able to pay, the same salary that a for-profit company might pay, or even a hospital that's down the block or something like that. But sometimes they will have really special benefits. Sometimes, especially government agency, may have benefits that you just don't see in the private sector, like a pension plan, for instance, like that just doesn't even exist in most places. So emphasizing those attractive benefits for people is really something to think about as a way to attract candidates. Same thing with the organization's mission. Again, when you look at research on, for instance, the Public Health Workforce Interests and Needs Survey, PHWINS, which is the largest survey of people who work in local and state government health departments, one of the number one reasons why people choose to work in public health is because they care about the mission. And so emphasizing what exactly does your health department do or your organization do, how does that serve the community? How does that make the world a better place? That can really motivate folks to consider joining the organization and to stay at the organization. People really do care. It's not just a job for a lot of folks. So emphasizing that in a job description can get you great candidates also. And then, of course, how do we even apply for this job? And making sure people understand that process. And that's another complication. I don't want to go on another tangent, but I know that depending on the agency, sometimes it's a slow process or a complicated process, especially for government. But communicating to folks about what that process looks like is something you could put in the job description, or at least let candidates know. So how and why should we be connecting these competencies to the job descriptions? One of these things just to know is that in human resources, it's actually a best practice to include competencies into the descriptions, into job descriptions. You can also use them in job interviews, competency-based job interviews. So if you look at the competencies for a particular job, and you can include that as, give an example of a time when you had to collect quantitative or qualitative data. That's an example of a competency-based interview question. You just take that same competency and start out with, can you give us an example of a time when? And then you now have a competency-based job interview. Now, one thing to remember is people learn a lot on the job, so they may not have every competency when they get started. So again, it may be that you use the competencies as part of their workforce development plan. It can be part of accreditation if you're going for the FAB accreditation. You can use this for retention. So again, looking at if you got a great candidate, they're doing an awesome job, you go back and say, hey, look at how awesome you did on these competencies. You're doing really great. You can also include that in training plans. The tiers, the 3 tiers that I mentioned, they're excellent for making what we call a job ladder, that you can have somebody start in that frontline position, and after a period of time, they've got all those competencies. Now they can move it up to the next tier of competencies, and that's how you can get them promoted, or you can put that into their training plan. Again, helping clarify roles. Also, having everyone know that these are the competencies and know about the 10 essential services and the foundational public health services. That's a way of bringing everyone together, that we all agree on something. You can use these in performance reviews, and just in general, like the statistics show that if you use competencies in this intentional way, you actually can reduce turnover and improve hiring of the right candidates. I see in the question that definitely the slides will be available afterwards. I'll send them, and I'll also share my email in case anyone wants, if you have any other questions. So all of these slides and all the references will be available afterwards. And so another thing to remember, again, like I said before, not every single job needs the exact same competencies. So you can start to look at how do we prioritize for specific jobs. You can do surveys. The Public Health Foundation has a competency selection worksheet, and they have this whole like template of a workshop that you can do with employees where you sit down and talk about the competencies. So you can go to their website and see that. You can identify what's priority for certain roles, and then also look at, like we showed before, the specific competencies for particular occupations. And I'm so glad people are sharing examples in the slides about how to use these in real life. So thank you for sharing these. I'm just going to take a look here. So thank you for sharing those examples. I was going to share a couple more examples in a second. So really quick note about job descriptions versus job postings. Like I said, you don't have to necessarily screen anyone out for based on do they already have all these competencies. Maybe they can also be aspirational, like this eventually is something we would want people to know. A job posting is basically like an advertisement, and it's more used it's usually shorter and sweeter. Not every health department allows the use of like short job descriptions. They want you to do the whole job description, the short job postings or job advertisements. They want you to list the whole job description. But sometimes you have the chance to use a shorter job posting, and in those, you might not include every single detail. So I'm just mentioning that because it can help with recruitment to have the short and sweet version versus the long detailed version. And then, last but not least, right, I do have, I did a study just to answer this question of like, does this actually make sense? Do these competencies actually show up in job descriptions? So I had recently done a study where I looked at a data set of more than 70,000 job postings. And just to put a spin on it, this was not super specific to government. It was just any organization that wanted to hire people with a master's degree in public health. And then I compared the skills with the CEF competencies, and you'll see that pretty much 100% the job postings that we see for people with public health degrees, they actually match with the CEF competencies. So anyway, it's just to show that, in fact, even if you didn't use them intentionally, it'll probably show up in your job description anyway. So before we go into examples and give some resources, I'm curious if anyone has tried this before. I see some folks have written questions in the chat. I'm curious if anyone here has done this, and if so, you can either like raise your hand and I can unmute you, or I'm going to pause sharing for just a second and just see, does anyone want to share if you've actually incorporated competencies into your job descriptions, or you have questions about how would you do that in real life? So just take a minute, and if you want to raise your hand and unmute, great, or you can write something in the chat. Do you think you will actually try doing this at some point, maybe in future? You can do a thumbs up if you want. Do you think you'll actually use this potentially? Okay, good. All right, I see some thumbs up. Awesome. I see a couple thumbs up. Give it a try. Okay. So I'm going to now just share a couple other resources and examples. So there's actually a lot of material about the core competencies on the TRAIN website. If you go to these, and again, these slides will get shared, but there's an intro to the core competencies. There's a workshop on, these are like recorded workshops, and some self-paced trainings. This first one, the intro to core competencies, is like it's a very nice kind of short and sweet training on just what are these public, core competencies. And then there's also a recorded workshop on how do we actually use these for job postings? How do we determine which of these competencies are essential for specific jobs? So these trainings are great to take a look at if you want to dive deeper. And then as an example, and I really appreciate somebody had shared an example in the slides. This is just a screenshot because of course these job descriptions are pretty long, but you can see these are also on the Public Health Foundation website. They have examples that you can see specific job descriptions, and you'll see, the same ingredients, the job title. You have some sort of internal information. Is it what pay grade? Is it a general summary, and then the essential functions? And then there's some more content. And then you get over here and you've got some of the core competencies from the competency models. Here's another example that is also from that same source where you'll see, a job description explaining this particular position. And then it actually has this whole list of, every person in the organization should have these broad competencies. And then they get into right here, they're talking straight out of the core competencies. They've got the domain 1 is right in there, and it explains, the competencies that you need to have. So these are just some snapshots. It's not the whole picture, but there's a collection of job descriptions that you can download and look at that include the competencies on the website. And there also is a reference in one of the trainings that I shared earlier about how to use these core competencies when you're going through the accreditation process. And so there's tons of tools. There's a few other resources I wanted to share. One of them is this new, it's just brand new, revamped, but basically there's this project that is through the Region 5 Public Health Training Center that I worked on 3 years ago. And we just like the last 2 weeks or so updated it, and it now has more job descriptions. And this is basically template job descriptions and job postings for public health positions. So now we're in the 2.0, which sounds fancier than it probably is, but we have this new sort of standardized job descriptions. And so if you are looking to revamp job descriptions, it's just another sort of starting place to take a look at. There's other resources that you can also use. These are more about retention and recruitment. And so if anyone is recruiting or wants to explore public health careers, you can visit publichealthcareers.org, which is the only site that includes very focused on governmental public health jobs and careers. And there's a lot of fun videos in there. There's also a career assessment that is in the publichealthcareers.org website that you can use it's like a little miniature quiz, and it'll tell you which public health careers fit your career interests. And then there's a couple of toolkits that have been created to help people recruit and retain people in public health organizations. And the last two links on here, these are really for individuals. These are for job seekers. So if you're doing recruiting or retention, you can actually connect people to this Charting Your Career Path course. That's a course that's all about, it's like a self-paced course. How do I figure out what public health career I want? So you could use this even with current staff. If they're especially if they're at the beginning of their career, they can take this training and it'll help give them some ideas about where they would see themselves in the future in public health. And then that last link is also a self-paced tutorial, and it's also for job seekers, but it gives people tips on how to navigate the governmental job search, especially for local and state health departments. And of course, there are 2,800 local health departments and 50 state health departments, and then there's territorial and tribal health departments, and they're all unique and different. But this training gives at least some big picture tips on how does this job search look a little bit different when it's government. So I'm going to wrap up and then we'll just open to discussion and Q&A. So please start thinking of your questions. I hope I can answer some of them, or we can find within our group, maybe someone else in this group will have the answer to a question or some suggestions on how to use this. But, final tips, takeaways, this is just a starting point for thinking about how to use competencies in job descriptions and for recruitment, retention. So you want to make sure you also work with HR, make sure that, when you actually write a job description that you run it past them. get feedback from people who are actually in the job. That's actually part of that process that Public Health Foundation suggests, that you actually do a workshop or do surveys where you talk to folks and say, hey, we're going to be, including these competencies. Do these look like what you actually need to do your job? Just to prove that, it actually is what we do for this job. And just know that, the future is very uncertain, but jobs really do keep changing. And there's a whole discussion. I recently worked on a project with the Association of State and Territorial Health Officials for a health department that was trying to create a new job description for public health informatics, because there's all the data modernization. And so figuring out, like, how do we write that description? That was a whole project. So it's going to keep changing. I am happy to answer questions. People can reach out to me. I do want to acknowledge the folks at Public Health Foundation. They gave some input onto this presentation. They also do consulting type of things. So if you're looking to have some support on how do I use this, you can reach out to them as well. And I just want to thank you for inviting me here today, and I'm excited to hear what folks have as questions, comments, suggestions, and all of those good things. So thanks everyone for being here. I'll dive into questions in a bit. I see a couple questions in the chat, so I'll just read those. Someone asked, how could AI be used to market public health core competencies? It's a great question. One thing I would just say is that AI could be pretty good at writing. I know that the one thing I will just say, I'm always a little cautious, maybe because I'm like a Gen Xer and I'm cautious about these things, but I do feel like you have to make sure a human being looks at it to make sure that what it says is correct. Sometimes AI will kind of make stuff up a little bit, but it can be really great at wordsmithing things. So you could go over to an AI tool, whatever one that you like to use, and you could put in a question and say, I am recruiting for, a position in my health department, and I want to use the public health core competencies to attract the right candidates. That could be your question. And then you would paste the competencies and do a prompt. You could say to your AI tool, if my target audience is entry-level community health workers, for example, or I'm looking for master's level social workers, whatever the group that you're looking to recruit, how would I use these competencies to attract that specific audience? That may give you it's just like another thought partner that could be able to help you kind of make these sound like a good marketing tool. I see another question in the chat here. It says, we're currently in the process of obtaining FAB accreditation, and we're updating our workforce development plan to align with core competencies. Next step will be to work with county HR to incorporate core competencies based on the 3 tiers and eventually incorporate these into performance evaluations. Okay, so that wasn't a question, it was more of like a comment. Thank you for sharing that. I don't know if you want to say anything more, because that might give other people ideas about how they might use the competencies. If that person is still here, Havert, if you want to share anything else.
Hey everyone, thank you for having me. This comment was basically based on something you had stated in if there was anyone incorporating the core competencies. So the FAB accreditation process has basically allowed us to really look at how we do things in public health and how to move away from the traditional stuff, right? So these frameworks have allowed us to actually look at the current positions, particularly because of the public health landscape is changing a lot. And one of the challenges that we have received from staff is the workforce development is a challenge. And also when we are performing when we're doing the performance evaluations, right, there's no standard for things. So this is where the core competencies came about, and incorporating those into the evaluation process. Of course, county policies are very county governments have very strict policies just to make sure that we are operating within the law, making sure that we're not, violating anything. So it is a lengthy process for us. Our process has to go through commissioner's court approval. But just to make it short, engaging HR from the beginning, telling them what it is that you plan to do, being very aware of what those county policies are in writing job descriptions, the things that you can and cannot do. And then once you know that, then you can say, okay, this is what we're going to incorporate. Will these things be allowed for us? So it's a lengthy process. It's particularly for health departments that may not be unique. We are a unique health department where we went because we have EMS, social services, and indigent health under the health and human services, as well. So this is not like your traditional public health. So these are things that we are incorporating, and we are working with those different departments that are not traditional public health programs. So that's helpful too.
Thank you so much for sharing that. That was really, really helpful. And you're so correct. This is exactly what I've heard from definitely on the project I was just describing, which was with it was a little bit different, but it was with a state health department that was looking to create a whole new job series, which included just like we were saying, tier 1, 2, and 3, and so forth for public health informatics, which was not a job series they had. They had epidemiologists and they had like computer programmer, but they didn't have this job that was a job where you're looking at all the data and making sure it all talks to each other and then running reports and all this kind of sort of a combo of computer science and data analysis and coding and anything like that. And that's exactly what they said, is that making good friends with your HR colleagues or civil service department is super important, because they will have to be partners if you're going to make up any new job descriptions or you're going to revise something. So, and if this is an HR person who maybe works across the whole government, for example, and they don't just specialize in the health department, introducing them to the reason why there are these competencies specific to public health, that might help also. So feel free to share these slides with them too, and that might be helpful. What other questions do people have or comments? I'd love to hear any other comments of how do these feel possible? Does this feel doable? Are there any barriers to trying to use this model? What do people think?
Dr. Kresna,
Yeah,
Guadalupe, we have maybe time for one question
sure.
because we're running low on time.
Okay.
And if silence means no more questions, I'd like to make some closing remarks. First of all, I want to thank you, Dr. Kresna, for your excellent and insightful presentation.
Thank you so much.
I think you provided all of us who are on this call some valuable guidance on how public health core competencies can enhance hiring, retention, and the long-term strength of our workforce, especially like the valuable resources that you provided to the participants and all the links, because I look at these links being information as power. So how to use that information and execute it within your own public health environment. So thank you for that. And on behalf of the National Hispanic Health Foundation and the Association of Schools and Programs of Public Health, I want to thank all of you for joining us today. And your participation demonstrates, let's say, our shared dedication to building a strong and sustainable public workforce, given the challenges and difficult times that we're in the public health space. So thank you again for your time and dedication. And with that, today's webinar is now concluded.
Thanks, everyone. It was great to meet you.
Thank
Feel
you.
free to stay in touch. I did put the slides in the chat, and I'll also be sharing them that you can pass them along afterwards. So thanks, everyone.
Thank you. Have a
Best
nice
of luck
day.
with everything. Yep. Take care.